allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. I'm going to begin with some organizational issues. First of all, I want to recognize that this is National Autism Awareness / Acceptance Month. Depending on which organization you're looking at, they're changing up the terminology a little bit. The Eagles Autism Challenge is in its 7th year and has raised over $22 million in prior years. So if you're looking for something local to get involved in, that's certainly something that could be exciting. They do bike races of different lengths on that day, and then they also have a 5K walk and run. And one of the really cool things they offer is there's a sensory walk for anybody who is on the autism spectrum and has any special sensory issues or needs. So it's a great inclusive event for anybody in the Philadelphia area to take a look at. This month is also National STI Awareness Month and National Oral Cancer Awareness Month. So that's the confluence of those 2 months is maybe a good reminder for dentists and patients to make sure that they're comfortable with having conversations about oral sex and safe sex practices as regards to oral sex. It is also Sexual Assault Awareness and Prevention Month and National Child Abuse Prevention Month. I think this month, possibly something that's on a lot of people's minds as relates to that is the recent documentary that got a lot of news about some of the former Nickelodeon child stars. It's called Quiet on the Set. In terms of anything that people who are not child actors or celebrities can maybe take away from that is that in some ways I think the way that children are sometimes taught about this issue is very often taught in kind of a stranger danger way, and really when you look at the statistics many times what's actually happening is there's a family member or a teacher or a priest or somebody else who the child knows. And in this case, obviously, it was most children don't have coworkers, but in this case, when you're talking about child actors, it was directors and producers that they had on the set who were presumably people that these parents knew and trusted. So I guess if there's one takeaway from that for the wider public to maybe have, it's about thinking about what the statistics about that really look like. It is also Medical Laboratory Professionals Week. When I did my recruiting work with Mainline Health, I worked very closely with the person who did their lab professionals recruiting, so I know he would want me to give a shout out to the laboratory professionals this week. So if anybody's had a test that was completed recently, they're the ones who do that work for us. It is also Minority Health Awareness Month this month, and something for people to be aware of is that the Census Bureau has announced some changes to the way that they're doing racial categorization, which will also flow down to how Medicare and Medicaid do it, which means that hospitals that use Medicare and Medicaid categories to do their patient data are going to see some changes. In particular, one thing that was added this year was a category called MENA, M-E-N-A. That's an acronym that stands for Middle Eastern and Northern African. So if you think of roughly Morocco to the Arabian Peninsula is roughly the geographic area you're talking about in terms of national origin. So they are now going to be their own category. They previously had been, encouraged to report as white, which many in that community felt was not an accurate description of themselves. And so this is something that community has been asking for that we're going to see moving forward. So it's something for medical professionals to think about. It's a community that can have some unique cultural needs, as any community can. So those were all of the milestones and dates that I was aware of for this month. I don't know if anybody else had anything that they were specifically aware of. And with that, we can move on to the review and approval of the minutes from last month. Did anybody have any notes on the minutes from the prior month?
Yeah, so I actually did read them, and the rant that I went on about measles actually was relatively coherent, but there's a lot of I think it was transcribed directly from the record automatically. I could edit it, but I don't think I need to. They're just mistakes, and I'd be happy to edit it, but I think it stands. So I would ask you, would you like me to? It's just punctuation, syntax, and grammar that did not come through.
Lisa, if David sends you a written copy of an update, is that something you can? Okay, so then, Maggie, I guess, is it appropriate to then just wait until next month and approve both? Okay, so we with the rest of the board's agreement, we will not vote to approve this month's minutes. We'll wait until next month and we'll approve 2 sets of minutes at the same meeting. With that, we will move on to reports, and the first one that I've scheduled is a report from our Community Support Unit officer.
Good evening, Board of Health. It is our pleasure to represent the Radnor Police Department in a very new and exciting initiative, one that I actually believe that you guys will find extremely interesting and maybe become partners with us as we move forward. If you're not aware, my name is Superintendent Christopher Flanagan. I'm going to let the team introduce themselves. We're all going to have an active role in this presentation. But I would like to open up that policing is a very important profession that needs to adapt. And I think agencies like medicine and some other things have us, they move a little bit quicker or a lot quicker in certain things like business to make change to the types of service and the type of things that people need. The Board of Commissioners and the Radnor Police are very engaged in our community and realized we needed to make some changes in our service provision. And one of the biggest ones was mental health. As we get started, I'd like to just acknowledge the Board of Commissioners, President Myers, who's also here. They really took a leap of faith where we added some police officers, which is against some current trends, to help support a new approach to mental health. And as you'll see a lot more, so I'm not going to steal from the presentation, but domestic violence, substance abuse, and other things, which we'll get into the sort of the nitty-gritty of that, is a real issue. Matter of fact, it's a daily issue, unfortunately. We wish it wasn't, but it is. So we wanted to meet that challenge by adding a new layer of service and de-escalation to incidents. And we did that by hiring our police social worker, Isabel Cook, who will go into, and she's standing to my right. And this was a real game changer. I believe we're the first in Delaware County to bring it in-house so that it is right there. And one of the things I'm excited about is the prompt response, that when they're on staff, one of the community service police officers, such as Officer Meyer, are assigned with the police social worker, and they respond out. There's a police car ready for them to go, and they respond out with the other officers to help meet whatever that challenge is, immediately get involved, and then give real professional guidance from a medical approach, a civilian approach, not a police officer. She's not carry a weapon. And that way we have a total team approach to people's problems. So we're very excited for that, and I'm going to bring up our PowerPoint and get right into it.
Chief, while you're doing that, I just want to say that the Board of Commissioners is thrilled to have supported the Community Support Unit, and their ability to de-escalate, to investigate, and to really do thorough follow-up has just been precious to us. Thanks.
Hi, everybody. My name is My name is Isabel. I'm the police social worker. When I started, just a little background of this presentation, we went to all the roll calls to all the officers to introduce myself. So it's a little bit of background about like my experience, explaining what a police social worker is, and then we kind of talk about some statistics and specific incidents because I think that they can be very helpful to see what we are able to do as a unit. I've worked as a social worker for the last 10 years. I am licensed as a social worker in Pennsylvania. The primary populations I've worked with have been victim services, so domestic violence, sexual violence, mental health, substance use, and veterans. I'm also trained as a psychotherapist. So the definition of a police social worker, defined as a specially trained and educated professional that promotes social change and development and engages people to address life challenges and enhance their overall well-being and development. I can provide counseling, crisis response to residents that are referred through police officers, can work within a department or through a social services agencies that contracted with law enforcement. Again, we respond to mental health, substance use, domestic violence, and unmet social needs calls. Also can provide resources for officer wellness as well. So some of my roles and responsibilities, providing support and assistance to members of the community in need within the context of law enforcement. So all of our calls, I would say 98% of all of our calls are coming through 911 right now. We do accept walk-ins as well, but that is primarily how we've been receiving our referrals. I collaborate with the officers to provide crisis intervention and de-escalation, assessments, referrals, and community engagement. Again, can be utilized within a department for officer wellness. Collaborate and working with community agencies and providers to bridge the gap between law enforcement and community members in need. I'm specially trained in crisis intervention and de-escalation. A lot of linkage and short-term case management for community members to appropriate referrals and resources. And a goal has been to reduce recidivism of certain community members and their use of law enforcement in 911. So some progress. I started October 2nd, probably started taking referrals within the first two weeks. Since then, we've had 262 referrals. These are repeat and also one-time referrals. They have primarily been mental health and domestic violence incidents. We've developed partnerships with the Domestic Abuse Project, Victim Services, MVP Recovery, Bryn Mawr Hospital, Miramont, Embark, Cornerstone Wellness, the Office of Mental Health, the Delaware County Department of Health, Radnor School District, and Ethos Treatment. And we're continuing to try to reach out to different organizations and kind of streamline those referrals if we can. I think just working in previous places, sometimes handing just a phone number or a list of phone numbers to someone is not helpful. So if we can do a more direct referral, we've been trying to create those relationships to do that. With the community support unit, that has been developed. It's myself and 4 officers. The officers are going to be specially trained and have been specially trained more specifically in crisis intervention and trauma, and we're working on getting them trained in more specific areas that I think would be beneficial to certain calls that we get. We've been introducing ourselves to different community agencies and providers. So I have my own separate documentation system that is completely separate from the police. I keep my own set of notes that they do not have access to kind of respect my code of ethics. So we've obtained that system. We've also written a policy for the program that we are working on getting approved currently. Again, some of the goals are reducing recidivism, connecting community members more quickly, also reducing follow-ups and time spent by officers. So if I can get involved and allow them to go back into service and their duties, that's a goal. And then providing them support in different situations. These are just some charts from last year. Like I said, it's been primarily mental health and domestic violence that we've been seeing. I've also seen kind of an uptick in dual calls where it's mental health and domestic violence, substance use, and mental health. And then these are our numbers last year when I started, and then up until this year, and this is updated to today. For other, we've been seeing an uptick in like harassment, bullying incidents, more geriatric calls I've seen recently. So that's what that other kind of covers.
Sorry, when you say geriatric incidents, you're talking about like elder abuse or?
Elder abuse, specifically, like, we've seen a few calls of like civil disputes regarding like power of attorney, like those types of issues where they're needing support from us. So that's kind of like why I tagged it as other, because I wasn't quite sure where it fell into.
Excuse me, the data for 2023, is that 12 months, while the data for 2024 is only
12. So 12 months is 3 months, so October, November, December. And then this month is January,
so
February,
it's the
March,
same,
April. Yeah.
same time period.
Yeah.
Okay.
Okay, so these are some specific examples that I kind of felt showed like how we can help in unique and different ways. The first one was a domestic violence incident. It was an individual that was in the process of getting a protective order against her husband. She was calling 911 quite a bit, asking questions around violations, questions that she was just calling 911 quite a bit. So I got involved. I was able to sit with her in person, walk through the protection from abuse order process, what constitutes a violation versus what doesn't constitute a violation. We were able to collaborate with the DA's office regarding violations, and this ultimately resulted in her not having to call 911 as often. I was able to kind of be a liaison between the department and her, which she found very helpful. Also, I'll just mention, we removed all like identifying information to protect everybody's confidentiality. I also, everything I talk, I make it clear to them when they meet with me that those are confidential conversations. Obviously, if it's some, harm to self or others or something that we would have to report, they're aware, but we try to keep it as separate as we can. The second incident was a burglary. It was an elderly resident who lived by themselves. They were burglarized, very scared, upset, was calling 911 quite a bit with concerns around their safety. Again, was able to be the liaison with that individual and the department. We were also able to help them obtain security cameras for their house and help them install them and kind of walk them through that process. Getting it set up through the phone so they knew, how that worked. So that's an incident. Another incident was a domestic violence and mental health incident. It was, again, an individual and their partner. There had been an assault. The perpetrator, it was not arrested because they kind of disappeared for a little while, so the individual was upset. We, again, were the liaison between the resident and the department, keeping them updated on the status of having their perpetrator arrested. We were also able to I was able to go to court with them, sit with them through that whole process, provide them emotional support, was able to connect them with the Domestic Abuse Project for like more longer-term advocacy and support and counseling. Another incident was a mental health incident. This was a family. Their son was dealing with some mental health issues. We were able to walk them through the 302 process, support them all the way, help them get approved for the 302, transport down to Crozier. We were then able to follow up with the family, connect them with some county resources that they had been unaware of before, support them through that referral process and filling out paperwork, and again, just that additional emotional support that they needed during that process. Another one was a substance use incident. This individual had been arrested for DUI. We were able to provide on-scene support. There was a minor child that was there. We were able to stay with that individual why they went to the hospital, help advocate with the hospital of where the individual would have liked to receive treatment. That person followed up a few months later to touch base with us, let us know they had to get some processing done for their arrest. We were able to sit with them while they were getting their fingerprints done, offer them that support in the moment. And then a final mental health incident. We got called, it was a hoarding situation. We were able to collaborate with Bryn Mawr Hospital. We're able to transport them to Bryn Mawr, worked with Bryn Mawr to help them get placed into a long-term facility with collaboration with the hospital, with their next of kin, worked with the apartment complex and the codes department to kind of get everyone on the same page in like the quickest way possible for this person. So, and that was a win, I would say. It felt good that they were able to get into the facility that they needed to. So some benefits. I can spend more time with community members, allowing officers to go back in service to other calls. The ongoing collaboration with various community agencies to better support our residents within Radnor Township. I can provide longer-term case management and therapeutic support to high-risk community members. I think bridging that gap between law enforcement and community members and creating those relationships within the community, and establishing more beneficial relationships, I think has been helpful too. We do work with our police chaplains program as well in collaboration, so they can also come to calls when it's requested. We do offer that as well, just their contact information. And then I'm going to let them talk a little bit more specifically about the community support unit.
As you can see, the impact that has changed with Isabel joining forces with us and utilizing all of those skills in a different approach. We are extremely proud of her, and in the short time she's been here, she's made such a major impact. And I'll talk just about inside our force as well. We're going to be working on an officer wellness program, which we hope to come back, brief the Board of Health on. But the point of this is that Isabel be a major part of that so that officers have the support they need so that they can do, obviously, a very important job in the community as so many other people did. The Community Support Unit was a presentation made to the Board of Commissioners where it was just not Isabel, it was a whole approach to policing. And unfortunately, Sergeant Lunger has worked very hard in a very important training session, but Officer Meyer and I are going to explain also what goes on. It is a team approach towards responding to the incidents we just went over, but also by providing a high-density beat patrol where we want to deliver rapid service. And one of our most important things is to try and get an early external defibrillator on somebody, help at a car accident with injuries, direct traffic to reduce another injury. And also, if there's a theft in progress, the community support officers who are not with Isabel, there is an officer assigned, they go out, they will respond to various types of incidents in the zone, really off of Lancaster Avenue, which we produced a heat map where we showed. And then they support responses to mental health emergencies should they come into question. So let's just say in Broomall, we had one of the calls that Isabel took us on, and they needed to be transported to a mental health facility. The community service team would join up with Isabel because they have extra training, and they would handle that, thus freeing up the police officer to go. And I'm just going to have Officer Meyer just talk about what the other duties the community support unit does as well on a daily basis.
Yeah, so I work 11 to 11 with 3 other officers that do it and then a sergeant, but we alternate. So I have a partner, and then there's 2 others that work opposite of us. So when they made the unit, they prioritized the mental health and domestic. That's number 1. And the number 2 is going to be like your community-oriented stuff, talking to the public, stuff with children, going to schools, followed by like investigating things. Police typically work 2 days on, 2 off, 3. So a guy could be off for a couple of days, and the next step would be like investigating things and finally being proactive. So a typical day I come in, if Isabel doesn't have anything for me to do, whether I would do some kind of community-oriented stuff or investigating stuff or just trying to be proactive if everything's caught up. But if she gets a call, if the sergeant, like today, the sergeant's in training, so I would take her. I would come back here if we had a call that would warrant her coming, like mental health related or domestic. I wouldn't bypass it if I was driving down the street, but that wouldn't be silly. Someone else can come get her. But, I'd come back, I'd pick her up, we'd go there. There would be no reason to be lights and sirens because there'd already be other officers there. And then we should show up in a much more relaxed environment. Like they said, this is how she dresses her day to day, so it's just a little easier. Just, a lot of times people just don't want to talk to us. They're mad. The other day I had a call. It was a family thing going on, and she just didn't want to see us. It's the last thing, and a lot of times we're just like, sorry, no crime happened. Here's a packet. Good luck. But it's been great just having for her, and so far everybody's interested, whether it's a homeless guy who doesn't really have ties to Radnor, he's just there, or it's someone in the public, and they've all been real receptive. They want to talk to her, at least see what she has to say. She knows way more people than we know, so lots of contacts. Yeah.
And then one of the other functions they do is if, let's just say you had a bag stolen out of your car, the community service unit will follow up with you as a victim of a crime. Often there's a nexus that comes together where they could use support services such as the burglary she described, where we're now finding out that people are impacted much more heavily than we even thought from the simple things. So in a burglary is a very stressful thing to go through. I hope nobody ever has to go through it, but it's very personal because they get into your house. But anyways, we've started this unit. We want to take a year look down the road. We just sent out a survey internally that Isabel worked on, and we were able to get that up and running just to get feedback from our teams to make a judgment. So I think we would love to come back and see the Board of Health. We gave you a presentation. I know you have other business, but I did want to take the opportunity while the team is here just to see if you had any questions for us.
Just want to thank you.
How's the decision made? I appreciate that you're doing a certain amount of longitudinal work with the community members that need it. How do you and when do you make the decision to hand that off to another professional?
I usually try to have at least 2 contacts with folks, like that initial contact and then a follow-up contact. And once I get them connected to that agency or individual, then I'll usually step back. That's kind of what I found to be the most helpful so far. I think there are obviously like one-offs that might need a little bit more support getting to that, but between 1 and 2 contacts before we step back has seemed to be the most efficient.
And I know she talked about relationships, and I appreciate that question. We are not here to replace or cut off anybody. In fact, we're trying to expedite you getting to that. But as you know, in everything, if there's a category, sometimes people are stuck in between 2 categories or just don't make that criteria. And this gap that Isabel fills in and gets people and has her medical skill set really helps us get them to the right agency. And also with the relationships she's building, if it's a real crisis, we can expedite that process, because even with best intentions, when we hand out one of our cards, also at 3 o'clock in the morning, Isabel is not on. So what happens is the officers and then the lieutenants, we review all incidents. We'll put attention CSU, and then they'll follow up from there. So that is how we make sure nothing slips through the cracks, or at 4 in the morning, something would happen. But we have had a real great relationship, and I think also with the Radnor School District, because they have so many counselors and we're advanced in their practice, tying all the loose pieces. So if you have 2 kids who have a simple fight, but it happens outside of the school district, now she's able to contact and work with that team, where normally we would be sort of limited to just telling the principal of the school this happened, and now we can go more in depth, thus tying together the different systems. I hope that answered your question, Doc.
It does, and I appreciate all this work. Thank you. It's a wonderful resource for our community.
Thank you.
So I agree. I want to, again, thank the commissioners for the work that they did and the police department for the work that they've done on getting this set up. This seems like a wonderful resource. I think you said 262 calls already, so clearly that's a resource that the community's finding valuable already. I wanted to ask, and this may be more of a jurisdictional thing that I don't know, Commissioner Myers, you might be able to speak to more. I'm curious about the relationship with, because Villanova, don't they have their own police force effectively on campus, and sort of what the relationship looks like there, since they're also part of our township and township residents for the 4 years that they're here on campus.
Yeah, there's an MOU that establishes police jurisdiction. So if there was an incident on their campus, they would handle it. As you are aware, there are Villanova students, a decent amount, that still live off campus. So if it's in our general area, we have it. And then depending, if it's a joint issue, we'll work on it together, sort of like I described the school district scenario. That does happen as well, because if it spills over an apartment and then it goes back to school or vice versa to the campus, if it's going to happen on the weekend, they let us know, and then we're prepared to assist that person or keep the pieces, if you will.
Great. And then one other question I wanted to ask. Are you sort of available as a resource for, obviously you talked about some kind of current incidents that are going on, but for somebody like at our meeting last month, we had a gentleman who was sort of an elder gentleman who talked about being a victim of sexual abuse a long time ago and the ways that it's still impacting him. For people who have maybe been victims of crimes in the past and maybe weren't able to get that kind of help because those resources sort of weren't available at the time, but they're still either dealing with the effects of it or they may, need some kind of ongoing support. Is that something where you'd be able to connect them with the appropriate resources?
As everyone here is probably aware, physical abuse and sexual abuse cases are extremely traumatic. Often people compartmentalize those, and all of a sudden there's a trigger factor that brings it back up. So this dual approach, depending on how you get to us, if somebody feels more comfortable talking to our police social worker, then that's why we have it. It is another way for them to feel comfortable communicating. But if you also want to go over something that happened, the police very well can do something. Many people make assumptions about following up and other things. We do have the ability, and one of the things sometimes abusers also carry on that, unfortunately, to other people, and we would definitely like to intercept and stop it from being a repeat situation to another victim. So it is very important for people to come forward. I would hope that anybody watching this, or we promote that with having a trained counselor on staff, it can make it easier. We know they went through a traumatic situation, but we can help ease through that and deal with it the best we can. But it is important for them to come forward. If you want to forward that person to Isabel or myself, we will absolutely happily follow up with them and see if we can assist in any way possible.
Great. Did anybody else have any other questions?
I just had one question. I feel like you are doing so much, and there's, the umbrella, under which the things that you cover is huge. I guess, is there anything that wouldn't be appropriate for you? Like, is there ever anything that you either need to turn away or say, this isn't really an appropriate, I'm not an appropriate resource, anything like that?
I haven't had anything. When I've had, I think the one that's come up is we'll have calls for people that don't live in Radnor Township. They've heard about us, and they'll kind of like cold call, asking for resources. We usually just try to connect them to the correct resource. That's kind of, if I can, my mentality is kind of, if I can connect them, I will do my best. But I haven't really run into anything that's felt super overwhelming. But yeah, I try to, as much as I can. I try to be transparent too, that we're in Radnor. But yeah, we've had a few from Lower Marion that have called, and we've just tried to redirect in those instances.
Thank you.
Yeah, thank you so much for coming, and we'll look forward to the CPR Stop the Bleed presentation that's happening afterwards as well. We're very excited to have the involvement of great police officers in our township, and thank you for all the great work that you're all doing. And with that, we will move on to a report from our school board liaison.
Good evening. Just want to say that was a wonderful program by the police, and it's very exciting to see that for the community. Schools are seeing a lot of seasonal allergies, as you would expect this time of year. Lots of sore throats, some respiratory illnesses, but other than that, just some minor colds and some lovely head lice mixed in with that. It's that time of year. Yes, 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 yes. Lots of spring fever, too, I think. Just a few general announcements for the district itself that I thought would be interesting for everyone to hear. We have a township mobile app now, so if you're looking for information about, events going on in the school district, you can download that from the App Store, from the Google Play Store, but it is very helpful. It has a calendar on that first page, and it has access to all of the information on the actual website for the school district. The middle school will be hosting its first annual career symposium on Thursday, May 16th from 8:30 to 10:10 a.m. They're still looking for speakers, so if you are knowledgeable in hospitality, tourism, manufacturing, transportation, distribution, and logistics, and can lend your time to the school, please reach out to Dr. Weidlich, their principal, or you can actually just email me and I can share that with him. All of the information can be found about the timing, et cetera, on the website as well. And then a very exciting announcement from the high school. Our Wish Warriors raised over $11,285 for Make-A-Wish Foundation, which was a huge accomplishment. Yep. For over the past 8 weeks, they worked together, and they were the top fundraising team for the 2024 competition, so kudos to them. As a whole, Rising Stars campaign raised over $73,000 for Make-A-Wish. And then last but not least, our middle school hosted Minding Your Minds this past week, and I believe one of the speakers is actually coming this evening, Lou DeSanto, who is a former student of mine. Minding Your Minds is a wonderful organization. All of their speakers are professionally trained young adults who provide educational programs that are built around their lived experiences and how they've learned and grown from them. And so our 6th, 7th, and 8th graders hear these stories and are very inspired and really hear stories of hope and recovery from young adults that they can really relate to and learn from. And that's it. Thank you.
Does anybody have any questions for Panayota or anything else related to the schools? All right. Then in that case, we will move on to our report from, actually, I'll just give a quick plug to any high school students, since it is, again, it's Autism Awareness Month. The Best Buddies Club at Radnor is, I believe, still going. It's a great club for anybody who's looking to get more involved with things at school. I think, Kiki, I think you have 2 children who did Best Buddies at Radnor. So that's a great thing to get involved with for any students who, if you're always hearing get more involved with something, that's a really amazing experience for the students who do that. And with that, I guess we'll move on to our Board of Commissioners liaison for her report.
Thanks, Alex. So not too much to report this time. We've been doing a lot of conditional use hearings and land development hearings, and not a whole lot that's applicable to this board. But there's one thing I wanted to mention, and that is the RAC, or Sulpizio Gym, at the middle school, which is owned by Radnor Township School District, but leased out by the township for use for various things, for Radnor's basketball, on and on. The roof has been leaking there for many years. And at not our past Board of Commissioners meeting, but the 1-2 weeks prior to that, we did go ahead and okay a hazardous substance, mold mostly is going to be the issue to be evaluated at the Sulpizio Gym, which is also being looked at for the roof and for window leakage and for other problems. But I was specifically thinking of the mold. It has been shown to be safe. The area that's of concern is the old locker room, and it's not in use at this point. People, if they change, tend to use the front bathroom because, and that's really the leaking side with the concern of mold. So I wanted to mention that. And again, I just want to give a round of applause to the Community Support Unit. They're really terrific. So much so that I think we'll probably be looking at a second social worker before too long. She can't do everything. And as you can see, she's going to be going out on maternity leave pretty soon. So we will have a person in when Isabella's out on leave. And then maybe if it works out, we could keep them both. I don't know. That's my hope and joy, so.
Great. I just, as long as we're talking about Radnor Township resources that are available for people looking to get some exercise, and of course, we're always talking about the environmental impact of health issues in the township. I just want to mention to anybody who's not aware that the Radnor Trail does have an exit that connects pretty close to this building. You just kind of come out and then you go around the apartment building that's back there. I made the walk over today. It's a beautiful day for a walk on the Radnor Trail. It's pretty much in the shade, especially in the evenings when our meetings tend to be. So it's open. People are out there walking and biking, and I didn't see anybody doing it today, but I guess it's also open for scooters, skateboards, roller skates. So please be mindful that we have this wonderful resource that can help you get around our township without a car. Anybody have anything else for Maggie? All right. So moving on to the county. So I have continued to take a look at the food inspections. I'm going to discontinue doing the written report only because it's information that's already available on the county's website. It was a good way of keeping myself on track with looking at it while we were making the transition over to county inspections. I'm very happy with the work that they're doing, and at a certain point, it's a matter of teach a man to fish rather than sort of continuing to put those reports together. Anybody who's interested can go to the county's website and look that information up for themselves. It's also being published in, I believe it's the Delaware County, is it the Delco Times or the Delco Journal, one of the local papers. The main thing that I saw over the course of the past month, and of course it is getting warmer and people are going to be looking more at getting cold drinks, is some ice machines that needed attention in terms of cleaning. That's definitely something business owners should be aware of. I know it's a conversation that I had with Marie when she was doing our inspections here in Radnor, that ice machines sometimes don't get the attention that they need, but it is important to clean them. There's not a set amount of time. It's usually whatever the manufacturer of the ice machine says. But it's actually also a very important opportunity to highlight employee cleanliness is actually where most ice contamination happens, because if you think about the journey of ice from the machine to the customer, yes, the machine needs to be clean, but then it's also getting, somebody's using their hands to touch a scoop that then gets scooped out. They're probably then putting it into some kind of a bucket or something and taking it to a bar or a satellite bar where it's potentially getting another scoop that's used to dump it into another container, and then you have another person who's scooping it out of that container and putting it into a glass, which also needs to be clean. So really there's 7 out of those 8 steps really are more about employee hygiene and employee cleanliness rather than just whatever the ice machine's doing. So it's definitely something to keep in mind as we go more into summer. The other update I had from the county is that last month was Women's History Month, and the county, they did something similar for Black History Month where they recognized a African-American member of the community who had made a contribution to the county. And for Women's History Month, they recognized Jen, I don't know if it's Babe or Bebe, but recognized for the county for the work that she's done in the area of suicide prevention. So that's something you can look up the article about her on the county's website and take a look at the work that she did, but I wanted to recognize that as well. From the Radnor Fire Company's blotter, I just wanted to highlight on April 6th at 1 a.m., someone called 911 to report someone yelling for help. This person was pinned under a car. They were transported to the local hospital. As our police officer just mentioned, they're working on being on the beat and responding first. So actually Radnor PD was first on the scene. But I just wanted to highlight that that was somebody whose life was saved because someone else bothered to call for them. So please keep your eyes out and make those calls if you see something for somebody who needs help. And thank you to Berwyn Fire Company for providing mutual aid on that particular call. With that, we will move on to presentations and programs. And first up is the student internship program. Ian, I don't see the screen anymore, but I think we still had Chloe on the line. Yep, there she is. So I don't know if, since we have Chloe and I don't think we have Finn, if Lisa and Chloe, if you want to start.
I am just excited to hear an update from Chloe because I've not heard if her, Chloe, you'll have to tell us if your survey was approved and where you're at with, I think it was posted on Schoology, so we'll look forward to an update.
Yep, I don't have a very, are you able to hear me?
Yes.
I don't have a very exciting update, but everything is approved and ready to go, but it is being posted to Schoology this Wednesday during an extended homeroom, so all the students will have a required time during homeroom to take it. So I'll have like as many people as possible to take it, so that's great. And once I have the data collected, the way I'll do it is with the Google form. It gives a pie chart to each question. And so for each section of the survey, I'll see that maybe 65% of that question scored highly correlated with the emotional, social part scored highly with the sleep deprivation part. So that's how I will do it. Just, it's easier with the Google form, if that makes sense. Sorry.
Well, that's very exciting. And again, I'm going to say congratulations on getting the survey through. And so are you going to be ready to present next month?
Yes, I will be ready next month.
All right, great. And
I can give a report since Finn
Sure.
is not here this evening. So he is readying his presentation for next month, and then Andrew has gotten him an opportunity, which is a week from tomorrow, I believe.
Yes,
Yes.
correct.
Where
Sure. So Finn and I are going, and if anybody else would like to go, next Tuesday around, I think it's 3 o'clock, we're going to visit the Indigo warehouse on 20th and Oregon in South Philly. And Indigo, if you don't know, is the Independence Blue Cross sponsored bike share program. So we're going to take a look at the facilities and see if we can pick up some helpful tips here and there.
that sounds great. And Finn's going to be ready to present next month too? Awesome. All right. And with that, we will move on to proposals for next year's student internship program. Did anybody have anything that they wanted to pitch or present for next year?
Something that came to my attention today was a National Drug and Alcohol Facts Week that's being presented by the National Drug and Alcohol Facts Week Committee, which is part of the NIH. And I was just thinking that might be a great resource for next year's students to present that during that week at the high school with general information or whatever they decide to do. There's a whole slew of information on the website, as well as resources and links. So that caught my eye, and I don't know if that would be something that anyone would be interested in.
All right. Did anybody else have an opportunity, or I guess I should also say that I think we've still preserved the option for one student to possibly do a presentation of their own choosing. Is there anybody who is interested in potentially serving as an intern supervisor for next year, even if they don't already have a particular project proposed? Okay.
I do it as well.
Okay. All right. So we will. So I guess then Andrew and Lisa, I'll connect with the two of you about sort of next steps about getting the request for applications out, because we said that this time I think we want to try and get that out before the start of next school year. So I'll connect with you after the meeting about that. And with that, so I wanted to do a follow-up on the presentation last month before I move on, does anybody have anything else related to the either this year's or next year's student internship program?
Turn this on. The only thing I was thinking about is after hearing Isabella talk, I'm wondering if we could do something, or if there's a way to propose something that would help either increase her resources that she refers. I don't know. My brain isn't fully forming a proposal yet, but I'm gonna think about it a little bit more.
Okay, yeah, that's actually a great idea. I'm sure there would be a student who would be interested in helping her with some things if they're able to do that. And that sounds like it would be a great opportunity if we could work something like that out. Yeah. All right, and with that, we will move on to I wanted to offer a follow-up to the previous month's presentation, which was for National LGBTQ Health Awareness. Oh, I put it in as month, but it was actually Awareness Week. So first of all, I want to thank the Radnor Township staff who have for the work that they do to make these events possible. Molly with the work that she does promoting it, Lisa, Marianne, and Peggy with the work they do behind the scenes to make these events successful, and then of course Ian with the work that he does recording the presentations and getting them up on YouTube and everything, and cutting back and forth between people as different people are speaking. Of course, that job's even harder this year because now they have to cut away to Taylor Swift for 5 minutes out of every 90 or something. I don't know what the exact rule is, but anyway, so thank you to our wonderful Radnor Township staff for all of the work they do on that. We got some great feedback from the event. I got positive notes from both the state rep's office and the state senator's office for our district, so that was great to see. The video from that event is now the most viewed video on the Radnor Township's website, and one of the other exciting things about that is that as people are getting more used to this series, some people chose the opportunity to check out the previous month's series as well. So combined, they now have over 4,000 views, and they're number 1 and number 7 out of the YouTube channel. So we're still working on the in-person attendance, but clearly these are resonating with the community, which is really great to see. We did have one person who showed up at the event and decided to make the comments that she made. With respect to our board business meetings, of course, people have the right to kind of say whatever they want. That's sort of the way that our board business meetings work. It's open to the public for that reason. For presentations moving forward, I don't know if, I don't think there's anything that says that we have to let anybody say whatever they want during a presentation, the same way that we do during public comment period at a meeting. Of course, I knew something like that could happen. Frankly, it could have happened at any of the events. I didn't know, when we did the opioid event, I didn't know for sure that somebody wasn't going to come and say, why aren't you being, harder on these drug people or whatever. So I let my guard down a little bit after I saw one person who has, made some nasty comments in the past leave, and then started actually handing the microphone over to people, which I wasn't doing at the beginning of the meeting. So I'm sorry to our presenters that ended up happening. I did also just want to offer a response to the substance of what she was saying, to the extent that what she was saying had substance. So there was a report from the British Health Services about transgender youth and some of the effects and recommendations that they want to move forward with over in the UK. The study that she was talking about is, without criticizing the content of the study, I'm just going to say it's a little bit overhyped in terms of what it was. It was largely a literature review, so it was a collection of and review of work that was already out there. That's not saying there's no value to a literature review, but it was not really anything new or groundbreaking. And of course, the other thing is that with a politically fraught topic, when you do a literature review, the literature that you pick can end up being a little bit selective. It's an issue that is political, and that's not saying that the person who did this study was intentionally biased one way or the other. But the results, speak to, I would say, some bias. So that's sort of the short answer, is that this was not really a blockbuster that debunked anything. In fact, actually, the report recommended increasing gender services in more regional hubs in the UK. But to the extent that anybody is trying to spin this as, the UK is outlawing gender care services for everybody is just not accurate. So that's really the only thing I had to say about that. But again, so that I'm not closing that out on a negative note, I just, again, want to thank everybody who came out. Thank everybody who shared and liked the video on social media, and then also everybody who took the time to then check out the prior month's presentation, which also had some really great information. That was great to see as well. Did anybody have anything that they wanted to say about either of the previous presentations? All right. So with that, the next two, I think we can basically just skip over. Bob's not here to talk about the oral health program, and as far as the presentation by Radnor Township Police, that's happening tonight after our meeting concludes. So I don't really have anything additional to share about that, other than that it may start a little bit late because the officer who's presenting did email me to let me know that he may be running a little bit late.
What's the topic of the presentation?
Tonight's presentation is Stop the Bleed, CPR. I think they're going to do a Narcan demonstration again as well. I think it's basically showing community members kind of first aid / first response that police do and that also community members can do to be helpful. The next one down on the list was, as Panayota mentioned, Lou DeSanto. I actually have not heard from Lou since our last meeting. We exchanged a couple emails back and forth, but I haven't really heard from him since the last meeting, so I'm actually going to take that off for now, and then when we reconnect, I will put him back on. But certainly that's another presentation that I would be looking forward to. Does anybody have any other presentation proposals that they want to either air at this time or kind of get out into the ether so that we can work on getting it on the calendar? All right. So with that, we will move on to discussion of community infectious disease. David?
Sure, I'll try and keep this as brief as I can. The three major communicable diseases we've been tracking over the winter were RSV, which is essentially quiescent until next fall. Flu, which happily we can report that flu influenza activity across the country and locally is on the decline, and so hopefully we will get out of flu season, which pretty much ends synonymously with Mother's Day. And it does not look like we're going to have another any significant outbreak. This year's flu season was not particularly noteworthy in comparison to other seasons, so that we've come through the years of triple-demic and all of that, and flu is back to what it normally is, with a case fatality rate of about 0.07% this year, which is an intermediate rate. And then COVID, which at this point has endemicized from the point of view of it's out there, but it's no longer tracked particularly well. There was a January peak based on hospitalizations, deaths, and wastewater, and that peak has eased. If you have a condition that makes you susceptible to acute or long-term adverse effects of COVID, you are pretty much on your own in terms of protecting yourself. There is no longer any mitigation. And COVID is not a seasonal disease, or has not yet become a seasonal disease like flu and RSV. So there remains significant work to be done on the determination of recommendations on the calendar for inoculation for those who need protection. And there's still discussion at the joint committee between CDC and FDA over the formulation of the next booster. And I think that moving forward, this is probably the last we will need of respiratory infectious diseases as we move into the insect vector-borne disease season, probably starting with next month.
Thank you very much. I also wanted to talk a little bit about measles. There have been, this is actually as of a few days ago because I didn't update this today, but as of a few days ago, there were already 113 cases of measles in the U.S. so far this year, 3 more, and we're going to be at double for all of last year. That, as I said, may have already happened in the intervening amount of time. This is a vaccine-preventable disease. 80% of the cases that have been seen in the U.S. this year have been among people who are unvaccinated, and another 12% involved people who had only received 1 dose of a measles vaccine. So in other words, they're not fully vaccinated. So if you combine those two numbers, we're talking about less than 8% of the people who did get infected are people who were fully vaccinated against measles. Additionally, we talked a little bit about last month about the state of Florida and how I forget if it's the Surgeon General or if he has a different title in that state, and what he was doing. 3 out of there are 16 states besides Florida that have seen measles cases this year, and 3 out of those 16 have already positively confirmed that there was a travel link to Florida in terms of their initial case. The decision that was made to allow people to allow students to continue going to school if they'd been in contact with people who had the measles and they were unvaccinated was really, in my opinion, an irresponsible decision. It's something to keep in mind in terms of the state statistics that people like to try to talk about in terms of this state kept things open, but they still had better results, or this other state did things differently. Florida in particular is a state that a lot of people like to take vacations to, and if they come back home to a different state, then that could count as a Pennsylvania case of COVID or measles or whatever the disease is, even if really they got it traveling to not just Florida, but any of the states that are popular tourist destinations. So I just really want to encourage people to take a look at that. For anybody who is not vaccinated against the measles, I would, unless you're allergic to one of the ingredients in the vaccine or have some real medical reason why you cannot get vaccinated, I would really encourage you to talk to a physician and take another look at that decision. That's just what I wanted to say about the measles. Is there anybody else who had anything on the topic of infectious disease? All right. With that, I didn't put anything under old business, but I did want to bring up something David sometimes had to talk about as board chair, and that now falls to me as board chair. My expectation for board members is that if things come up, and sometimes we can't make every meeting every single year, it is my expectation for board members to email to let us know if you're ahead of time, if you're not going to be able to make a particular meeting. Additionally, I wanted to bring that up in relation to the fact that we now have this approval for hybrid meetings, which I'm grateful that we have the ability to do that. Again, I'm going to ask that board members who want to make use of that hybrid option should please be emailing myself and Ian prior to the start of a meeting in order to get that. We're not going to just send the link out to everybody every time, because that's a security issue for some of the newer members who weren't on our board at the time that this happened. We did have an issue in the past where the link got hacked and we got Zoom bombed, and it was not a pleasant experience for anybody. So for security reasons, we're only going to be sending that link out to people who want to make use of it for that particular meeting. So please, if I understand sometimes things come up last minute that day, but just make sure that that email comes in before the start of the meeting, because there's no guarantee that myself or Ian is going to be checking our email in the middle of a meeting. With that, I don't have anything under new business. Did anybody have anything they wanted to bring up? All right. With that, we will open the floor to public comment. Are there any Radnor residents who wanted to make any public comment this evening? All right. I'm not seeing anybody. So with that, I will take a motion to adjourn.
Motion to adjourn?
I'll second.
All right. All in favor? Aye. All right. Motion is approved. Meeting is adjourned. No. Sorry, and very quickly, so we're going to take just a 5-minute break for anybody who needs a break, and then we'll move into our presentation from the Radnor Township Police Department. so you're presenting, right?
I'm presenting, I don't know what, but I'm basically just going to explain the equipment that we carry, and we offer CPR classes.
Okay.
And I teach them, and I get some contact information if anybody's interested.
Okay. Yeah, I'm not sure what kind of turnout we're going to have tonight, but we've been
Less
getting
is
plenty.
more.
We've been getting plenty of views on YouTube, so
Okay.
you can teach to the camera too, I guess.
Yeah, there will be no, I will not, I'm just showing what we carry and what I use for teaching tools. I'm not going to actually do any kind of CPR or anything like that, because obviously that you can't properly demonstrate the
Right.
procedures when you're not physically in a classroom. So
Right.
I'm not technically supposed to be teaching CPR on camera.
Gotcha.
So,
Okay.
so it'll just be a gist of explain. I'm not going to tell everybody on the camera that, but I'll just be showing what we carry for the police department and offering our resources. I'll go into like how I'm trained and what I do and my experience level, and that's it.
Okay.
So it should be fairly quick. If that's okay.
Yeah. And
Okay.
is the presentation going to be on your body camera too? or-
No,
Okay.
it's just because I worked all day. So.
Okay.
Yeah.
All right. Yeah. So let's just give it another minute.
Yeah,
for
no
anybody
rush.
to take a break,
I just want to get
and
this
then-
nasty card out.
Yeah, and then we'll get.
Okay.
If we could just get you using like this mic or a handheld. you know,
Yeah,
go
can I
with that.
reach this one?
I'll turn
This
the
one
thing
reach?
around for you so it'll be a little easier.
All right.
As long as it's pointing at you, we'll be all right.
You'll be able to catch me?
Yeah.
All right.
Test, test.
Yeah, I'll just hold the stuff up, so what they have available.
Yeah, if you need a bigger tape, we'll bring one around.
Nope.
We use
I'll
this
fit it
one
all on.
to Catch it on the camera.
Yeah, I'll fit it all on. very kind to actually show up for me. Oh, I might be done by 7. Yeah, all the important stuff will be out right away. So I appreciate that. You ready to get started? Okay. All right. Will it be televised or?
Yeah, I guess as much as you can try.
Okay. All right. So my name is Sergeant Mike Fisher. I'm with the Radnor Township Police, obviously. I've been here for 23 years. My role here is primarily I run the first squad. So we have 4 squads. I run the first squad. They were working all day today, so I've been here since 6:30 in the morning. But we all have additional duties that we're responsible for. Among other things, I train for field sobriety testing. So I certify the new officers for field sobriety testing to properly train them on how to administer field sobriety tests. I'm also our only first aid and CPR instructor, so all the officers get certified every 2 years through American Heart Association, and I'm the one that does that training. So in addition, I also offer classes in the township building for the community. So that's the primary purpose in which I'm here. There's number one, there's a bunch of equipment that we carry in the police cars, which I'll show you what we carry, but I'll also show you what you'd be exposed to in the classes that I would teach. So the classes run typically from like 7 p.m. to 9 p.m. You can just send me an email. I'll give you that contact information at the end of this. If you're interested in having a class, I'm limited to 10 people at a time. So if you send me an email, I'll put you on a list and I'll create a class. We'll kind of communicate back and forth when would be good for you. But typically it's 7 p.m. to 9 p.m. And you'll get a book to keep. It's $45 for that does not pay me. That pays American Heart for the book and for the card that you'll get, okay? So the township has to pay American Heart for the cards and the books. So you'll get to keep the book and you'll get a card that certifies you for CPR, AED use, CPR for infant, child, and adult, and AED use for them, as well as basic first aid. So that covers you for all of that. And again, some of the equipment that we use, these are the tourniquets that we carry. They're typically actually black, just to match our uniforms. I carry them in different pockets, so I don't carry them on my actual belt. Some officers carry them on their belt, but they operate the same way. So these are commercial tourniquets, and I use this as a demonstration in my class to teach people how to apply them, when to apply them. These are the mannequins that we use during the classes for infants to teach them how to properly assist the choking infant and how to administer CPR on an infant. And these are the mannequins that we use for adult CPR and choking. The equipment as far as we carry in our police cars, we have 12 of these units that we just bought last year. They're very new. Zoll and Stryker are competing brands. So some of the equipment that we have is Stryker brand, some of it is Zoll brand. There's not a whole lot of difference. But recently, Zoll and Stryker both came out with a different type of AED that only uses one set of pads. So if you're familiar with AEDs, they're typically, there are 2 sets of pads, one for infants or possibly children, small children, and there's another set that's larger for adults. Really, the only difference is the machine detects the different pad and administers a different amount of electricity. Well, Stryker said, well, I think it's more convenient if you only have one set of pads, and then we can just have them push a button to change the amount of electricity that goes through. So Zoll found out about it, and they created their own model of the same thing. So this is what we purchased. So there's only one set of pads. This is in top of the line. This is what Penn Medicine uses now. Pennsylvania State Police uses this machine. And I believe we're the only one in this area that uses this Zoll machine. These were actually built last year in June. So they're literally only a year old, the machines themselves. So once you turn this machine on, which I will not do because it's exceedingly loud, the screen actually lights up. It tells you everything you have to do. It tells you to remove clothing. It tells you to check the patient for breathing. It tells you to take the pads out. All the pads are designed the same way. And inside this little package, there's 3 different styrofoam things that will go on based on the display. Okay, so if it's a child, you use a different display that's in the bottom box here. And if you have a child that's 7 or under, you would just push the button to change it instead of using different pads, which sometimes can get a little bit hectic when you're in a pretty crazy situation like cardiac arrest. So that's the ADs. This is a little bit different. We have 2 different kinds of pads for these. These are still in use in some of the cars that aren't used as often, but the officers are originally trained on these, so they know how to use both. We have 1 more that we just purchased for motorcycles. Our motorcycle guys, I literally gave it to them today. They have a smaller device that you'll see in the lobby here and downstairs. That's probably yay big, that fits in their side compartment. So now we even have a motorcycle out there that has an AED in it. So the one thing that is different to that all law enforcement has to carry now is what's called Narcan. So Narcan is an inhibitor for when you're taking OxyContin or something like that. If they're getting overdose for fentanyl or heroin, we can use this to block that receptor in the brain. So to do that, there's different ways of delivering the medication, but we use the nasal. It's the safest, cleanest, in our opinion. And you just peel this off. This has 1 dose of medication in it. Each box has 2. So the officer will then peel this back off, stick it up the victim's nose, squeeze it once. It shoots the medicine up and through the nostril, and it goes immediately into the brain receptors. Typically, the reaction, I've administered, 10 of these or so in my time. The reaction is typically very fast. If they don't respond within a minute or so, we usually administer 2. I've seen them go to as many as 4 before the person starts coming around. It is a very traumatic scene because they, no kidding, look dead. I mean, there's a very faint heart rate, if any, very sporadic breathing that is not much there. To use this and have them be able to talk to us within a minute or 2 is pretty crazy to see. But it's a little bit scary because they get a little agitated. So people that are watching might think we're being rough with them, but it's not because they don't know where they are. So they'll originally come out, they'll start running around, they might run out to traffic. Our goal is to keep them contained. We're not trying to arrest them necessarily. We just want to make sure that they get to the hospital, which is where they need to go. We don't let them refuse. They have to go to the hospital. We will typically say, if you don't go with them, you're going with us. So our goal is to get them to the hospital so that there's no recurrence, because a lot of times this medication has a duration, and if it starts fading while they've refused to go to the hospital. 5-10 minutes later, they could crash again. Okay, and then by then we're gone. The last thing that we carry, which is fairly new, is something that stopped the bleed. There's there's a class that you can take online to do it, but these kits are in every. We bought these this past year toward the fall of last year. So at our annual training, I had the Public Works Department. Every vehicle that the township owns has one of these kits in it. Not only the police cars, but the Public Works vehicles, and they have more than we do, that are out there. So trash trucks, everything has it in it, because quite frankly, the stuff that they deal with is probably a lot more dangerous than a lot of the things that we will have to deal with routinely. So inside the kit has a couple pairs of gloves. It has a blanket for, it looks like aluminum foil, but when you open it up, it's reflective, so it actually does keep you warm. There's 2 packs of wound packing gauze, which has an agent in it that when you pack it inside a very large open wound, it starts to expand and will cut off the bleeding a lot quicker than just covering it with a bandage. There's also some trauma dressings in here, and which is in here, and there's also a tourniquet that we can use. We actually stuck some Band-Aids in here too, because most people, when they get a cut, they mostly just need a Band-Aid. So we added this. But again, these are in all the kits. There's really not a whole lot of training. The wound packing gauze is ideally for large wounds that they can't get stopped bleeding. The tourniquet is typically only for an arterial bleed, but if you can't tell the difference, we'd rather you put a tourniquet on and stop the bleeding. That's it. That's really fast. Does anybody have any questions about what we do, about anything I just talked about? Yes?
I had a question about
How do
Mhm.
you tell the difference between somebody who's just out of it high or somebody who is like in imminent danger? Like I ride the L and there's a lot of passed out people and it's hard to know like who's passed out and they're just minding their own business and who's passed out and like. Well, breathing is usually a big factor. So if they're just passed out and they're breathing fine, just let them be passed out because they're not in any medical danger. Visually, I mean, they're probably sleeping. In other words, if they're not breathing properly, then that would be more of a concern. And you can't always tell, but it's based on the symptoms that they're demonstrating at the time. Sometimes when we look in a car, we can see syringes, we can see little containers that they carry the drugs in. All those, we put that together with the condition of the victim, and we're like, okay, well, they're probably overdosing. The good thing about Narcan is that there's very little side effects. So even if I stuck this up my nose and shot it up there, it wouldn't really do much to me, okay? And I'm not overdosing. So that's a good thing because then you'd rather give it to them and not need it, right, than not give it to them and they needed it. So the only thing that I've heard fairly recently is because of the potency of the drugs that are out there. If you give too many too soon, so if you get up to 4 within a fairly short period of time, you can have a rapid or irregular heartbeat. My opinion is I'd rather them have an irregular one than not have one at all. So my officers, when I teach them, I say, you need to wait a minute or so before the drug to have an effect, but less time for the second dose, a little more time for the third, and probably by the time he's ready to get a fourth, ambulance is probably there, okay, and let them make that decision. That's typically how we handle it. Any other questions? Yes?
As far as ventilation, what do you carry in your?
I personally, I'm also an EMT, so I also carry a pocket mask. We have in our the boxes that have the AEDs in there, they have we have a CPR mask that you can use to cover their lips with. It's just a clear plastic, and it has like an opening so that you can breathe in and you're not touching their mouth.
Yeah, simple, not like
Yeah,
a bag.
so that we carry those but it's not required. Quite frankly, I'm not sure that American Heart will be continuing the rescue breathing by mouth.
They're more for.
More, yes, because that's been proven to be more beneficial. And the time that you spend breathing the 2 breaths as opposed to constant compressions is far outweighs. So it's very difficult to calculate that because the person's, they possibly will die. And if they do, we can't say, well, was it beneficial? Was it not? If they do, we don't know if it was the compressions or the breathing that helped. And how do you calibrate that or how do you quantify that? It's very difficult. So I think that's why there hasn't been a change. It's safer to keep it the way it is. The big thing is they want to get oxygen on them really quick. So there is a bag valve mask that the ambulance will get on them right away, and that will be connected to oxygen. So you'll have somebody that will hold the bag valve mask on their face and then squeeze that bag, which will administer 100% oxygen. That is definitely beneficial. Okay, but we can't do that if it's just me by myself. I can't do both. So, and we don't carry oxygen containers in the police cars. But yeah, good question. Anything else? Okay, thank you for your time.
Thank you so much.
Yep. Oh, my email address is mfisher, Fischer, @radnor.org, or Alex has my contact information. So if you're interested or you know anybody that's interested, it's based on the need basis. Like for example, I have 3 classes coming up for Radnor summer camps. So I teach the counselors. There's a list that they have that they're expired. So they come to me and get their training and get their certification for 2 years so that they can, the camp staff can have counselors that are certified and all this stuff. All right. I do not offer them at Villanova because, as you can see, these come in 4 in a bag, quite heavy. There's 2 of these. I have 1 of these. I take the AEDs. I take books. I have a lot of equipment I have to bring. But Villanova is welcome to come here, and I will host a class here. I am sure, since they don't have their own ambulance, they probably offer something similar. I know for my field sobriety class, I taught a couple of the Villanova police in my class. So we do have an agreement where we'll, train mutually, but they've never asked me to help with CPR training or anything like that. So they probably have their own instructor. So if you go there or you work there, you probably might be better off going through them. But I'm happy to have you if you want to do one of mine. I'm probably a better instructor. No, I'm just kidding. So any other questions?
What was your email again? I got the M. Fisher part.
M. Fisher, FISCHER, @radnor.org. Real easy. Yep. And again, I can do up to 10 at a time. I can do 10 at a time, and I'm fairly flexible. It's based a lot on my schedule. I like to try to do it. I know it sounds like having a 14-hour day is long, but I'd rather, because I have 2 kids, I'd rather be here longer and not have to come in on the day I'm off than, yeah, so. All right, thank you. Yep. Hope that was good enough, Alex. Yeah. All right.
Perfect.
Thanks for serving.
Sure. Yep, thank you for coming.
Thank you very much for coming out.
Yep.
Yep.
Thank you.
We heard from CSU earlier.
Sir?
Thank you.
Yep, you're welcome. You have?
Yeah, we heard from CSU earlier
Oh,
today,
good.
so.
Oh, Officer Meyer.
So we had